Hi guys, hope you're all well. Doing another video today on my hip replacement. So pre-op and post-op, the dynamics changing the home, medication, GPs, and a nice little tip for anyone who's on the waiting list. So try and cut it down for you. Diagnosed last February with osteoarthritis, caught it very late, so I was bone on bone. Got physio, my first physio appointment was in May last year. That was it was 9 weeks based over a 12-week period. There was 3 weeks off, I don't know why they done that, but there was. July I had my consultation with the surgeon. In the consultation meeting I did ask for cortisone injections to see if I can delay it, but bone on bone means no cartilage. Cortisone injection, you need a cartilage, so, or some form of cartilage. I had neither, so December was my op date. On the pre-op assessment you go through all the scans and tests, ECGs, blood tests, BMI, and then whilst there the nurse said it would be up to 18 weeks for the operation. That panicked me because I was already off of work for a month, so I didn't really like that feeling at all. That's quite worrying, to be honest. I can't be off work that long. So, but she did say, and this is the tip, that I'm down for routine op. So anyone out there who's on the waiting list, find out through your GP if you are on routine op. If you are, you can get them to expedite it to emergency op. It just fast forwards so much for you. It honestly will. That was a good little tip from the nurse. So that was on the Friday. On the Monday, spoke to the GP. They got it expedited. On the Thursday, I got a letter telling me in 3 weeks' time we got the op. The op went well. I was in for 3 days. Loads of meds, high as a kite, suppositories and Tramadol and morphine. Really good mix, yeah. And then home time 3 days later. So whilst home, very overwhelming. The support was absolutely first class. Forever grateful for that. But it changed the dynamics a little bit because someone else is now doing something for you. You need everything at hand. You're not allowed to lean over one way or the other. You know, you can't go further than that, and you can't pivot. So everything you need, like your bedside, is usually against the wall, isn't it? So bring that forward at arm's length, just so you can grab what you need, your cup, your book, your laptop, your glasses, your whatever it is that you're doing and you need. Just have it all on hand. And same with your chair in the sitting room. Just have the table there at arm's reach so everything's accessible. You won't be moving much in your first week regardless. Everything seems to be 6 weeks. So you've got stockings for 6 weeks. Not supposed to have a shower or a bath for 6 weeks. You can't, your legs have got to be on a 90 degree angle for 6 weeks. So you can't drive your car for 6 weeks. So all the meds are coming out of your system in the first couple of weeks, and whatever meds your GP's given you, cocodamol or to that effect. So you're not really with it. Like I said, you're overwhelmed, you're not really with it, with the meds. You need a good support, first and foremost. Bit difficult if you're on your own, but speak to your GP and try and get as much support, family, friends, if you have any. That's really important. It's really difficult to be on your own, I should imagine. So that's not good for your mental health. So get the support set in place. Not one person, get a couple people if you live on your own. You know, you need 2 or 3 people. Things happen in life, people, they don't deliberately let you down, but sometimes, unfortunately, life gets in the way, doesn't it? So try and get a good support around you. You need to be transparent all the way through with your support, with your GP. Let them know how you're getting on with the meds and everything, and whatever else they can do in offering support. Your work is an important one as well. So you're going to be off, depending on your job and your meds. I was off for 5 months in the end. Could have been 4, but the meds extended me by a month, and plus I was going through personal problems. So you've got to be transparent with everybody. Don't hide your feelings. Don't hide what you're going through, because it will have an effect. I mean, you're cooped up indoors for a long time, so I'd say after 3 weeks, physio gets involved. I think that's once a fortnight, I think, for me. But you need to do the exercises. They give you exercises to take home, and it is the single most important thing is to do the exercises. 1, it helps your recovery. 2, it gives you that little determination to just, when the chips are down, it gives you a little push, you know. That's really important, and you'll find yourself doing more around the home. They tell you don't overcook it. You're not going to know what that means until you start doing it. You know, I remember when I got the Hoover out for the first time, I ended up doing the whole house. My partner was out and told me off, but the house was done, and I felt really good for it. Really good for your mental health, just to be able to get that bit of independence back, you know. So when you go out for your first walk, I'd say 2 weeks, 2 or 3 weeks, go out for your first walk. Don't think you're going to walk around the block, because you're not going to be able to do it. You'll have 2 crutches. So, I don't know, just do 10 or 20 yards, whatever you can do. When you start to feel tired, that's it, it's stop. Give yourself a breather for 5 minutes, and then turn back, go back in. And do that every day if you can, or every other day, just to build your strength back up. It's important to build your knees up. And while you're doing all these exercises and the walking, and you've got good support, it really is really good for your mental health. You know, so, and that's important. So the exercises and the walking when you can, even when everything's a target. You know, you have to shower for the first time, that's a target. You sit in the car and drive the car for the first time, that's a target. Your first proper step outside, that's a target. And over the course of a period of months, your physio will start to see you once a month. Then they want to take a crutch off you, another target. Then you walk up the stairs with the 1 crutch, that's a target. Then towards the end of your recovery, they take both crutches off you. And then you find yourself, you can walk up the stairs without any aids. It's amazing. It's a real amazing achievement. So any of you watching it has been through it, you know what I'm talking about. Any of you are waiting for it, there's little targets that you look at it now and you think, yeah, okay, I can walk up the stairs anyway, or I struggle up the stairs. But just to have, when you're restricted and you want to do something but you can't, your body just, your legs are just like naughty kids, they're not listening to you. You know, all these little targets, they absolutely do wonders for you. But the key takeaways are, be transparent. You need a good support network. Remember the dynamics of the house changes. So you're out the game for a little while. A lot of pressure on your support network. If you're in a home with children, you're restricted, they're restricted. If you've got pets, they're restricted with you. You know, so just be aware of this before you go in and have that little conversation with your support. It just gives them a little heads up, you know, so dynamics do change. So keep that in mind. The medication, send you all over the place. You're void, you're not with it. Your judgment calls ain't the same. You do things out of character. You'll find yourself maybe being on the phone a lot more because you can't watch too much more telly because you've seen everything. You know, there's only so much you can do, but get out as much as you can every day. You're allowed to. You know, when you're tired, give yourself a break and turn around and go home. Set your little targets up. So now you want to walk around the block, but you want to do that, give yourself a week or two target to do that. Don't do it in 1 or 2 days. You have an adverse effect with your recovery. So, you know, I had a blood clot, so you've got to bear that in mind as well. Take your stockings off for an hour a day. You've got a partner there to help you, amazing. You've got a foot spa, don't turn the bubbles on, just soak your feet or in a bowl. Yeah, these are all little things that no one really tells you. The physio doesn't tell you, the nurses don't tell you, the surgeon doesn't tell you. So that was my experience with having my left hip replaced. It's similar, be the same for the right side, and very, very similar for the knees. 6 weeks seems to be targets for your hips. As far as I'm aware, it's 8 weeks, but same processes. So if that helps anyone, happy days. Just a little bit of knowledge, but the freebie is the waiting list. Expedite it. Go to your GP and expedite it, because we all know the waiting lists are ridiculously long, and that affects your mental health as well. So happy recovery if you're on recovery. Get it expedited if you're on routine, and good luck with your ops, and share your experiences. You know, it's what we're here for, isn't it? To pass on a little bit of knowledge. You either gain something out of this or you don't, but knowledge is free, you know. So good luck in your operations and on your recovery. Love you guys.